Great, so welcome everyone to today's webinar. Today's webinar is all around diabetes, and this is to mark World Diabetes Day, which took place on the 14th of November, so just earlier this week. My name's Kate, and I'm the Community Engagement and Events Coordinator here at IHMRI. I'd like to take this moment to acknowledge the Dharawal people, the traditional custodians of the land on which IHMRI sits. I'd also like to pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal people present on the webinar today. So 466,927 people are living with diabetes just in New South Wales and the ACT alone, with 297 people diagnosed every single day. Diabetes is unfortunately particularly prevalent in the Illawarra Shoalhaven region, with 10.6% of people aged 16 and over having diabetes or a high blood glucose, and those are statistics from 2018. And so today we're going to talk about the impact of diabetes and the impact it has on all demographics of our society, with a particular focus on type 2 diabetes. We'll also be discussing what type of support is available and a broad range of treatment options for those already diagnosed. And we'll also be discussing various thinking behind the remission of type 2 diabetes and whether that is actually possible through diet. So on our panel today, we have Dr Monique Francois. Monique is leading a study funded by New South Wales Health, looking at therapies to reduce the burden of cardiovascular disease in people with diabetes or those people at risk of diabetes. Monique studies whether the timing of exercise and the reduction of carbohydrates can play a role in reducing heart disease. And Monique is a University of Wollongong and IHMRI researcher. We also have Beenu Bastian. Beenu is a diabetes educator and a clinical nurse specialist in diabetes education over at the Illawarra Shoalhaven Local Health District. She has extensive knowledge and experience in diabetes education, especially pregnancy, type 2 diabetes, type 1 diabetes, and she has completed her postgraduate qualification in diabetes education and management from Deakin University and Flinders University in Adelaide. She is also doing an integrated PhD at UOW in the topic of gestational diabetes, and Beenu's passion is empowering people with diabetes to make positive changes for better health. So welcome, Beenu. And Natalie Nicholls. Natalie is a senior diabetes specialist dietitian at the Illawarra Shoalhaven Diabetes Service. She's worked in the area of diabetes for 14 years. She's worked with clients of all types of diabetes, including gestational diabetes, type 1 diabetes, and type 2. She has a passion for coaching people to improve their health through physical activity, diet, and lifestyle change, and keeping the client front of center of their own personal health journey. So welcome to all of our panelists today. And our panelists really want to hear from you. The purpose of today is really to provide a platform for our audience to ask questions and to make use of the expertise that we have here today. So any questions that you have, if you could please pop those in the Q&A function at the bottom of your screen. And by all means, feel free to use the chat function to share any experiences that you might like to share. That would be great. So we really want to hear from you today. A recording will be available, and I'll send a link around to everybody who is registered for today's webinar. And finally, for those of you who don't know, the Illawarra Health and Medical Research Institute, better known as IHMRI, is a not-for-profit charity that supports health and medical researchers in the Illawarra Shoalhaven region. We bring scientists, doctors, and health professionals together to solve our greatest health challenges through research. And our scientists are working hard to find better ways to prevent and treat diseases such as cancer, diabetes, mental illness, and dementia. And that's just a few. So if you'd like to see a little bit more about the work we do, head over to our website, www.ihmri.org.au. So over to today's webinar, and I thought we would just start with a quick poll just to find out who we've got on the call today This is completely anonymous, but we just want to get an idea of who we're talking with. So I'll launch this poll, and it's really just to find out a bit about you and why you're here today. So as I said, this is completely anonymous. Why you're here today: you either have diabetes or you're caring for someone with diabetes, you're pre-diabetic, just for general information. And please ignore the last one. That should not be there. Apologies for that. So just going to give us an idea of why you're on the call today. All right. Okay, let's wrap that one up. Okay, so you should be able to see that. So we've got 16% of people living with diabetes are here today. 11% are here because they're caring for someone with diabetes. And 8% are pre-diabetic, and 55% of people are here just for general information, which is wonderful. So welcome to all of you today. To start with, I think we're going to jump over to Beenu just to talk us through a little bit about what actually is diabetes. What does it mean to live with diabetes? What are the different types? Beenu, could you share some of that information with us?
Sure. First of all, thank you, IHMRI, for giving us this opportunity to talk about diabetes. We just passed the World Diabetes Day a few days ago, so this is the perfect time to talk and raise awareness about diabetes. And as you all know, we all know someone with diabetes. Trust me, it's that common, isn't it? Like, we all know somebody. Technically, diabetes is just a condition where your body finds it hard to deal with the glucose or sugar that's coming into the body due to problems with the hormone named insulin. Yeah. So, we need to understand a little bit more about insulin to start with. I usually tell my patients, think of insulin like a little traffic controller in your body. So when glucose or sugar comes into the body, as soon as you start chewing your food, your pancreas kind of realizes that, okay, there's sugar coming in, and it releases the insulin. Okay? So by the time the sugar reaches our bloodstream, insulin is already there to move this glucose from our blood and to be transported. It will help in the transport to the cells where it could be used for energy. Okay? So that's what our body uses all this glucose for. It's our fuel or energy resource. So insulin helps in transporting this glucose from our blood to the cells to be used up. So what happens is that when people have risk factors for type 2 diabetes or diabetes in general, what happens is that either our body is not producing enough insulin, or your body might have developed resistance to insulin. So basically, the differences are based on what kind of diabetes we have, but that's what happens. Either you have an insulin deficiency, or you may have some insulin resistance. Okay? So usually, if the body is finding it hard to process the glucose that's coming in, we have a really good system in our body, and pancreas tries to compensate for that by releasing extra insulin. Okay? It's doing all the hard yard, trying to make up for the mess. So it will try and release more insulin, but that's not really the problem. It's just that our body is just, the cell receptors in our body are not listening to insulin, and it's not letting glucose into the cells. So now that's causing an influx of glucose in our bloodstream, and that's how high blood glucose levels happen. Okay, so that's the very basic pathophysiology behind diabetes. And some excess glucose gets actually stored as fat, and the storage takes place in the liver mostly. But then after a while, if liver is just the storage place, so if there's more glucose that's coming in than what liver can hold, and if it's full, it starts dumping the glucose back into the blood itself. Okay, so that's the main pathophysiology behind diabetes. But depending on the type of diabetes, it's a little bit different again. Do we know what the types of diabetes are, or do you know which type is more serious? Do you want to run that poll now, Kate?
definitely. Let me pop that poll up. Oh, so the poll, only some types of diabetes are serious.
Yeah.
So this is just a true or false poll, which is to get an idea of what our audience thinks. So only some types of diabetes are serious. Is this statement true or false? Okay. Let's give you a few more seconds to answer that. All right, let's launch those results. Beenu, can you talk us through that answer?
Yeah, so 6% have answered that it is true that only some types of diabetes are serious, whereas the majority has said, 94% has said it's false. So yeah, all kinds of diabetes are serious. Yeah, that's true. Kind of, each kind of diabetes comes with its own problems. So depending on the type, things are a bit different. So I'll start with maybe type 1 diabetes. So type 1 diabetes accounts for almost 10% of our total diabetes burden. And that's the most common type of diabetes, which you usually see in kids, in young adults, in youngsters, but it can occur at any age. And every day, almost 8 people get diagnosed with type 1 diabetes in Australia. With type 1 diabetes, what happens is that all of a sudden, your pancreas just goes on a strike. So there's absolutely no insulin being produced at all. Okay, so it's caused by an autoimmune reaction where your own body tries to fight against those insulin secreting cells in the beta cells of pancreas. And as you know, you need insulin to use the glucose up for energy, and without insulin, this glucose can accumulate in the blood and cause life-threatening problems. So people with type 1 diabetes would need insulin from the very first day of their diagnosis for the rest of their lives, because we don't know what causes it, and we haven't found a cure for it, unfortunately, although research is progressing. Sometimes people with type 1 diabetes use insulin pumps as well, just to make it easy. It's not easy to live with type 1 diabetes because there's no holiday from it. Once you're diagnosed, you need insulin from that first day for the rest of their lives. Okay, so that's type 1 diabetes. And you might have heard about gestational diabetes. That's the one which you usually see in pregnancy. So gestational diabetes is usually described as diabetes that's first detected in pregnancy. So in Australia, almost 1 in 7 pregnancies are affected by gestational diabetes, and it's one of the most common problems in pregnancy. So what happens in pregnancy is that the placental hormone wants to make sure that baby gets all the nutrients that the baby can get. So due to the placental hormones, there's an added insulin resistance in your body. Okay, there are some risk factors as to who develops insulin resistance, but because of the placental hormones, there will be raised blood glucose levels for pregnant women. So some of it can be transferred to the baby. But the problem is when through research, we have observed what levels are so good for women, what levels are not so good. And there's countless studies coming out which shows that a perfect intrauterine environment is really good for the babies in the long term. That health investment starts right from the womb. Okay, so that's very important to manage gestational diabetes. And the primary management for gestational diabetes is, dietary changes, lifestyle changes, and some women may also require insulin to manage diabetes in pregnancy. So that's about gestational diabetes. And well, we'll move on to the main topic, type 2 diabetes, which brought us here today. So type 2 diabetes accounts for almost 85 to 90% of the total burden of diabetes. And we'll discuss about how common it is soon. The thing is, it just doesn't happen overnight. Okay, it takes months, maybe years, or even decades for it to develop. So it actually, when someone is diagnosed with type 2 diabetes, it's just the tip of the iceberg. The problem goes a long way back. And what happens, as I said before, is that it's caused by your body developing resistance to insulin, or it doesn't let insulin do its job of, directing the glucose into the cells. So insulin has a lot of functions in our body, and one of it is, to help the cells take in glucose. It also prevents liver from releasing extra glucose. It sends hunger signals to brain. It helps, it prevents the release of, fat molecules into the blood. So it does a lot of things. But when there is insulin resistance, it shows that this glucose is getting stuck in our blood despite high levels of insulin. Okay, and your body, as I said before, tries to compensate for it by releasing more, but it doesn't work, and it tries to transport more to the liver. It still doesn't work. Liver is saying, hey, I can't take any more. So it starts dumping glucose in the blood, and that's when a person gets diagnosed with it. So all these background things that I mentioned before has been happening for months or years before a person gets diagnosed. Okay. So the problem is, after a while, our poor pancreas, after all these years of hard work of trying to keep the equilibrium, would get tired out, and it causes, eventually it can cause a decrease in insulin production. So even people with type 2 diabetes may need insulin at the, as it progresses, based on, how well they manage their diabetes at the start. And there are also other types of diabetes too, which are caused by some, diseases of the pancreas, as well as some genetic conditions. And it could also be induced by some medications that you were prescribed. And some diagnoses, as you know, are hard to be made, or, to be fit into a category, because, there's so much there, so much out there, and there's a lot happening. So people with, diabetes, or, and if you can't put a name to it, they will need additional testing to see what's actually causing it. Do they have any antibodies? Are they producing insulin? What are the other hormone levels, and which will help us to determine what kind of diabetes it is. Yeah, it's a lot of information in one go.
Yeah, well, I imagine it's a particularly complex disease by itself. So you've done a great job, Beenu, of explaining the different types. Thank you so much for that. I just want to type a quick launch another poll around whether diabetes can be cured. What do we all think? So again, it's a true or false question. Do you think type 2 diabetes can be cured? Let's give you a few more seconds to answer that question. All right. So Monique, could I ask you to just talk through those results?
Whoa. So we're about 50-50. And so now I get to talk about the really exciting part, because I guess like a long-standing belief was that type 2 diabetes could not be cured, and that once you had it, the natural progression over time would mean that you would require medications, and then maybe further medications, including insulin. But now new research has come out, and we've kind of thought about this for a while, in the sense that we were gobsmacked by why some people that had bariatric surgery, their diabetes after surgery was just gone. And so a lot of researchers were looking at what happened there, what happened with the hormones, was it the weight loss? But it just happened so quickly that it was really, really interesting. And so moving forward from that, some nutrition studies are now looking at whether certain diets, and these are extreme diets that require a lot of help from experts, that whether these diets can reverse type 2 diabetes. And the good news for everybody is yes, they can, but there is still a lot that we do not know. So I guess moving forward, what type 2 diabetes remission is it's that your diabetes, so your glycemic control, which is often measured by your HbA1c, which is a longer term marker of how high your glucose levels have been across the last sort of 8 to 12 weeks. And so type 2 diabetes remission is when you no longer need certain medications in order to manage your glucose levels. And so your glucose levels are now below that threshold for being diagnosed with type 2 diabetes, and you no longer need that extra support and to be able to do that. That is not saying that you no longer need to follow your diet plan, but there is evidence to suggest that perhaps the removal of fat around your organs through these approaches and maybe some beta cell regeneration. So your beta cells are in your pancreas, and so they're the ones that secrete the insulin. And so there is new data to suggest that the destruction from the beta cells that occurs with type 2 diabetes or hyperglycemia, high glucose levels, this can actually be reduced. So this is really exciting in terms of curing diabetes, and that you can begin to manage your sugar levels without the need for medications. And so this video explains it a lot better than me. And this is new research that is coming out in humans, which is really, really exciting, through big clinical trials that are happening overseas. And so this little video here will give you a break from listening to me. And I just hope that I shared the right screen.
Meet Jim. Jim's got type 2 diabetes and wants to put it into remission. What's remission? To explain, let's take a look inside his body. The pancreas is a really important organ that makes the hormone insulin. Insulin travels around the body and helps our cells to use glucose as fuel. But in people with type 2 diabetes like Jim, insulin stops working properly, and there might not be enough of it at the right times. This means glucose builds up in Jim's blood, damaging his body. Jim used to manage his diabetes with diet, but now he needs medication to stop his blood sugar levels rising. But our scientists thought there could be another way. They wanted to see if type 2 diabetes could be put into remission. They believe a buildup of fat inside the liver and pancreas could be the root of the problem. They're running our direct trial, testing a new remission program, and Jim is a trial volunteer. With support from a dietitian, he swapped his usual food for low-calorie soups and shakes, which helps him to lose weight quickly. After a few months, the dietitian helps Jim to keep the weight off by eating the right amount of healthy foods. Our scientists looked at what was happening inside Jim's body. Over time, the fats inside his liver and pancreas started to disappear. His pancreas is now making the right amount of insulin at the right time, and his insulin is starting to work properly. This means that Jim's blood sugar levels are healthy without needing any diabetes medications. He's in remission. Jim still has an annual review with his doctor, but he's now much healthier. Back out on his bike and running after the family, he's likely to have a lower risk of diabetes complications, like heart disease. It's life-changing. Remission isn't possible for everyone, but losing extra weight has lots of benefits. Better sleep, you can move more easily, and you can feel better emotionally and physically. It can also help to reduce your risk of diabetes complications, and you might need fewer diabetes medications. The weight management program tested by our scientists is amongst the strongest evidence we have for remission so far. But there are different ways to lose extra weight. Find something that works for you. There's still a lot we don't know about remission. We want to help people keep their weight healthy and stay in remission. We also want a treatment that works for people of different ethnicities or who are a healthy weight already. That's why our scientists are working hard to build our knowledge, so that together we can make remission a reality for as many people as possible.
So how cool is that? I think especially for those that are in the early stages of type 2 diabetes, there is definitely real hope for the future. And I hope that as more research comes out from the direct trial and other trials like that, and hopefully some in Australia very soon, where we'll be able to tailor type 2 diabetes remission for all different types of type 2 diabetes, which is more complex than we really understand at the moment.
On that note, I might just explain what are the, how do we classify different types of diabetes, if that's any good, just to get a better understanding and what it actually means, or what's the significance of this remission. Yeah, I might just share my screen if that's okay, Monique.
Yeah.
Okay, sorry, there we are. Getting the hang of it now. Okay. Can you see it now? Sorry.
No, not yet.
Okay. Is it happening?
No.
Okay.
Perhaps if we
There
aren't
we
able
go.
to. No, can anyone else see it? I can't see the screen. No.
Okay,
No.
that's fine.
Well, perhaps Beenu, we can share it. We can share the slides with. So I always send a follow-up email to everybody. So perhaps I could include the slides in that follow-up email.
Yeah. Okay. So what
there we are.
Oh,
We've
there
got
we
it
go.
now.
Okay. Right. Okay. That's good. So what we were trying to discuss before is, with the remission.
Sorry, Beenu, just hit play from start so we can see the. There we go. Perfect. Yeah. Thank you.
So as we discussed before, with the insulin resistance, that's a precursor for type 2 diabetes. And that's one reason why how our body has been, able to process all the glucose that's coming in. So where it all starts is with some of the risk factors that causes the insulin resistance. And that's, among risk factors, there's some that are modifiable and some that are not so modifiable, like our family, our genetics. We can't do anything about it. But there are some risk factors where we can actually do something about it in terms of our weight, our inactivity, or our lifestyle, all those things. So when these risk factors are not addressed at that stage, it progresses to insulin resistance, and it usually takes 10 to 15 years of insulin resistance, or a state of pre-diabetes before it progresses to type 2 diabetes. And the difference between pre-diabetes and type 2 diabetes is all based on the numbers. So from a normal sugar or a fasting sugar of 6, when someone has pre-diabetes, it goes between 6 and 6.9, and when someone has type 2 diabetes, the level goes above 7. And when you have pre-diabetes, we say, yeah, it can be reversed, it can be controlled. Whereas when it goes to type 2 diabetes, we had this belief that, once you cross the line to type 2 diabetes, we couldn't reverse anything, or, we couldn't put it into remission. It's progressive from there onwards. And that's kind of the significance of remission. Now we know that with lifestyle changes, even when you're diagnosed with type 2 diabetes, things could be put on hold for a while. And I've just got some, I don't know if you have heard of the HbA1c levels. So that's the annual progress report for someone with diabetes. And this same test is used for diagnosing diabetes as well. So, when someone has diabetes, or when someone gets tested for diabetes, GPs usually prescribe this test, HbA1c, to see where they are. And if the levels are under 6%, we say, yeah, it's normal. When it's between 6 and 6.4, we say, oh, you're at risk of developing diabetes. And when it goes above 6.5, it's definitely type 2 diabetes. And, myself have told my several clients before all this evidence came, that once you're in the pre-diabetes stage, you can always go back. But once you cross to the fine line of, type 2 diabetes, there's no going back. So you can only control it. You can't reverse it or put it into remission. But that's what's changing now, and it's so exciting.
Sorry. So we've spoken a little bit about risk factors. Monique, can you talk us through what some of those risk factors are?
Risk factors for type 2 diabetes?
Yeah.
I think we all know these ones in the sense of poor lifestyle, having a poor diet, lack of physical activity, and that's now being divided into purposeful exercise that you do, as well as spending a lot of time sitting and sedentary. Overweight, obesity, which is related to the previous two as well, a family history of diabetes, previous gestational diabetes, so previous diabetes in pregnancy. I think those are the main ones that I quite often think about.
Yeah, okay. But you mentioned that there are ways that we ourselves, with the help of our team and doctors around us, can help to either prevent or to reverse diabetes through change in lifestyle. And can you talk us through some of the research that is being done in this area?
Yeah, so I'm going to save Natalie some space, and I'm just going to jump to the important research that is happening at IHMRI.
Yeah.
And I don't really know why I've got a slide for this, because I can definitely time it out. But some of the research, just really quickly, is we're looking at exercise, and we're looking at personalizing it about what time you should be most active. So we know that muscle contractions or exercise can help remove excess glucose from the blood and put it into the muscle, the exercise that you're doing. And so we look at your glucose trace, and then we prescribe the best time to exercise, and we're seeing if that can work better than exercise at any time. I've got a new PhD student who's looking at low carbohydrate diets and finding the sweet spot in terms of trying to get your glucose within time and range, and looking at your carbohydrate intake across the day in different amounts. And then my exciting study that I'm really looking forward to starting next year is we're looking at a diabetes version of the Mediterranean diet. So a lot of my research looks at how we can prevent cardiovascular disease in people with type 2 diabetes. And the Mediterranean diet is one of the most, I guess, well-known and touted diets for cardiovascular health. But we also know that sometimes it's not diabetes friendly. And so we're looking to adapt that for people with diabetes and seeing whether that can improve cardiovascular health. And so the exercise study is ongoing now, and the 2 diet studies, we're really looking forward to starting next year.
So are you looking for trial participants as well, Monique, for these studies?
Definitely.
Okay. All right. Well, perhaps if you could share the information, or I'll find the information and I can share that with our audience after the webinar, if you are interested in taking part in any of those studies happening at IHMRI. So we've mentioned diet a few times now. Natalie, can you talk us through how diet can play a role in preventing and treating diabetes?
Yeah, well, thanks for having me today, and thanks everyone for joining the session. Today, what I'm going to do is present quite a general overview because of nutrition for diabetes prevention and remission. And I guess the main part is that there's not a one size fits all. And you know, these position statements talk about these quite restrictive diets. And for some people, that's not going to be something that they can do, or they find they're going to struggle with that and they need a lot of support. So it's not the be all and end all. If you can't do that, there are many different options, like Mediterranean diets, like low carbohydrate diets, and many different ways. So one of my big messages is that it's really important to work in partnership with health professionals who specialize in diabetes treatment and prevention, and to create an individual plan that will inspire you to follow and therefore to stick to it in the long run. Because there are so many diets that are marketed to us. And research shows that people may get success in the short term from following these diets, but in the long term, it can produce what might be a term of yo-yo dieting. You might have heard of that, where someone loses weight quite rapidly and they're getting really good health results, but then all of a sudden people return to their old eating habits, and that weight gain is quickly, people go on to regain weight and often gain more weight than previous, and then they go on another diet and then they gain more weight. So that can happen, and what the focus should be on is, okay, people might want to explore starting a diet, but in the long term, the focus should be on how to set up a sustainable lifestyle change to ensure that diabetes doesn't return. Because if you can do this, you can do diets and you might get success, but if you return to those old eating habits, all that great work that you've done during that time on a diet may be lost to returning to old habits. So it's all about lifestyle behavior change is very important. So there are many benefits to our health when we eat well, and things like getting better sleep quality, lowering blood glucose levels, and in turn those HbA1c results that Beenu was talking about will be influenced. You can get more energy from eating better quality diet, better gut health as well. There's a lot of research in that area at the moment, and also diets that, like Monique was speaking about, that help to lower cholesterol levels. So in terms of some nutrition focus areas, because I know you're all keen to hear about those sorts of things, I'm just going to share a screen. And remember, this is really, to me, this is a bit of a starting point for people to think about how they can influence change to improve their health. So can we all see that? Let me know when it's coming up. Maybe like Beenu.
It's trying to share your screen, Natalie.
Yep.
Oh, there we are. We've got you now.
Oh, yep. There's a little message there. Participants can see it. Okay. So firstly, sorry, this picture's a little blurry, but what you can do now to help with preventing and perhaps somewhat controlling diabetes is to firstly look at your portions on your plate. And most of my clients indicate that this is an area that they can really take control of now and monitor the most. So a healthy meal, breakfast, lunch and dinner, should be something like this image in front of you. You might have a quarter of the plate protein. So that might be an egg or the piece of palm-sized piece of meat that's indicated on that plate there. A quarter of your plate might be low glycemic index carbohydrates, which I'll talk about in a bit more detail soon. But see the portion of that. We're talking half a cup. You're measuring cups, half a cup. So one slice of bread with one egg for breakfast. And you might have some grilled tomato, grilled mushrooms, handful of baby spinach on that plate as well. You start to create a very healthy, balanced meal. Another example for a lunchtime meal might be a tin of tuna with all those healthy vegetables. And for that low glycemic index carbohydrate, you might put a small tin of corn through that salad. So you don't have to have lots of bread, but ensuring you have small amounts of good carbohydrates on that plate. That good carbohydrate is going to help with your energy levels. So it's really important to include it in a healthy, balanced diet.
Natalie, should I launch that poll around carbohydrates?
Sure.
Is now a good time? Or
Yeah, that's fine. Yep.
Okay, so just, I think this will be our last poll, everybody. So it's around the types of carbohydrates. What type of carbohydrates should I eat for a good diabetes diet, for diabetes control? So is it no carbohydrate? Is it small amounts of high glycemic index carbohydrate, or small amounts of low glycemic index carbohydrates?
I've given a few clues already in what I've already said.
Or maybe we'll see if people have been listening.
True.
All right, just give you a few more seconds. All right, let's end that poll. There are the results, Natalie. What do you make
they've all been listening very well. So how much carbohydrate and the type of carbohydrate should I eat for diabetes control? No one indicated no carbohydrate. Very good, everybody. Small amounts of high glycemic index, 3% people thought that. But it really is the small amounts of low glycemic index carbohydrates. It's going to help immensely in diabetes control, and watching, importantly, those portions of those foods on your dinner plate. And this idea of the half portion of carbohydrates, low glycemic index carbohydrates, is really leaning towards a low carbohydrate diet plan. Not no carbohydrate diet plan, but a low carbohydrate plan. So just moving through my slides, here we go. So when it comes to eating meals across the day, it's really important to space out those meals and the carbohydrate foods over the day, and preventing a huge big amount of carbohydrates at one meal, because otherwise that will really influence your blood glucose levels, and your body will struggle to break down that carbohydrate or sugar from that food that you eat. So we do recommend small meal, breakfast, lunch and dinner, and maybe a small snack in between those meals. And the reason we say a small snack is to help prevent that ravenous hunger that sometimes we feel when we come into lunch and dinner and we haven't eaten for a while, and we just go, oh, I've got to grab something before I eat my dinner, or we go back for seconds because we're not quite satisfied yet. So that small snack between meals can really help to prevent overconsumption at meal times. An example of that might be a piece of fruit, a small tub of yogurt, Vita-Weets with cheese, some air popped popcorn, or a handful of healthy nuts as a snack. And eating at those regular intervals will fill you up and keep you full for longer. So what are the best types of carbohydrates to eat? As I mentioned before, the glycemic index is an important measure that we still use to help us decide if the food is quite a good food for us to give us energy, or something that we should just be really limiting in our diets. So we have high GI foods, and that's foods you'll see there that will follow the red line there. So our blood glucose levels when we eat high GI foods will rise, our blood glucose levels will rise very quickly. And then the energy that we get from those foods will drop out of our system very quickly. And we often go on to crave or want sweet foods later after that time. So maybe in 2 hours time, we're like, oh, we're really peckish now. Let's grab a chocolate biscuit to get those blood glucose levels back up. And we really want to try and prevent that. So what we know that low glycemic index foods release the sugar from that food much more slowly into our blood. And you'll see there on the blue line, the carbohydrate or the sugar that we get from that food just raises our blood glucose levels to a nice steady rate, and then it slowly slowly burns up out of our system over time. Often people who follow a low glycemic index diet tend to find that they're not craving as much for those sweet treat type foods, and they're quite satisfied eating low GI foods because they are known to keep us fuller for longer and prevent our blood glucose levels dropping down too low or jumping up too high. So some examples.
Sorry, were you just about to give some examples of low GI foods?
I was.
Excellent,
yes.
Ignore me.
That can answer the questions that are coming through.
Yeah. Thank you.
Very good. All right, so just try and get to the next. Oh, too far. There we go. Okay, so what are the best carbohydrates to be eating? The best ones are whole grain breads and whole grain crisp breads. And there's another bread, a sourdough bread is actually a low GI bread choice as well. Whole grain breakfast cereals, so oats and muesli and Special K are all fantastic breakfast cereals to be choosing. Grains such as barley and quinoa, so those grains are known to have a lot more protein in them, and that can also help with satiety as well and filling you up for longer. And they have low GI carbohydrates in them. So pasta is actually, and noodles do have low GI carbohydrate abilities. So we'll release the sugar very slowly, but it all comes down to that portion of carbohydrate at the end of the day. And that's one big thing that I tell my patients and clients is that half a cup of pasta or rice is the go-to, not the big, you go out to an Italian restaurant and you've got at least 4 cups of pasta on that plate, and we divulge in all of that. And that is way too much carbohydrate than what our bodies need in one meal. So portions of those foods is very important. In terms of rice, basmati is generally a good one. And there's one called Dungara rice, which is another variety of rice, which is low GI and will produce those more stable blood glucose levels when you eat them. Things like lentils and legumes are great for our health, give us plenty of fiber for our gut health, help with cholesterol levels, and also have very good quality carbohydrates in them. Starchy vegetables such as sweet potato and corn are our lower carbohydrate vegetables. And again, portion of those foods, 1 small or half a cup of sweet potato would be a suitable portion on a low carbohydrate diet plan. Fruit, most of our fruit is low GI, but watermelon is a higher GI fruit. And I tend to say to people, it doesn't mean that you should never eat watermelon. Everything needs to be eaten in balance and in moderation. But when it comes to watermelon, just 1 slice of watermelon is a suitable amount. You might notice when you eat it, your blood glucose levels jump up a bit more. The example I hear a lot of in clinic is, I can't eat bananas because they send my blood glucose levels very high. I tend to say to people, well, a small banana is going to be a suitable portion, but sometimes these days I get bananas and they're twice the size. Perhaps it's the size of the banana that is causing those fluctuations to those blood glucose levels when you check them. So portions is really important to think about. Milk and yogurt are also foods that tend to have a good type of carbohydrate. They provide calcium for our bones as well, and are very good foods to be consuming and eating in a healthy, balanced diet. And then just a few other tips, because I had 10 minutes that I could speak for, 5 minutes, and I've probably gone over that already. But just a couple of other quick points that I wanted to bring up today, and I'm trying to get that slide to jump ahead. Why is it not going? It's very sluggish, isn't it? Mm. The other tips that I just wanted to mention today are you might need to have a think about your alcohol intake. Alcohol has a lot of carbohydrate in it. alcohol itself. A lot of people say, oh, I get the low carbohydrate beers and things like that. But the alcohol is also contributing to your blood glucose levels. So I can't get this presentation to move forward. Ah, there we go. So they have recently revised the recommendations around alcohol, and it's no more than 10 standard drinks per week and no more than 4 standard drinks on any one day. So they're the new alcohol guidelines. The other things to think about is exercise. It doesn't have to be a marathon run. We're not expecting big, well, Monique might want to say more about that actually, but at least some low intensity exercises can be a good way to start, including resistance exercise can be very important. And they do talk about 30 minutes of physical activity a day is the recommendations. And Monique might have more to say on that. Did you want to say anything at the moment, Monique, or did you?
No, just that anything is better than nothing.
There you go. I was on the right track.
I just wonder at that point, I might just ask a quick question. Monique, it was from, where did I see it? From Linda. Oh, you've answered.
Yes. No, I said I wanted to do it live.
Oh, so Linda asked, are there any suggestions so far through the research Monique has done around the best time to exercise?
This has been really, really, really interesting because I used to think that the biggest spike was after breakfast. But, and then the new research coming out is suggesting that the evening is the best time to exercise because quite often you're quite sedentary, you have your evening meal and then you sit down for the rest of the night and then you go overnight. And so they're suggesting that the evening might be the best time to exercise in order to control your blood sugar overnight. But our data, which is looking at continuous glucose monitoring, personalizing it, it's all over the place. It really depends on you. And so that's why we're using the continuous glucose monitoring to find out when your biggest spike is. So without knowing that, the best time to exercise is to do a little bit after every major meal, because that's when you'll quite often get that blood sugar spike. So if you just do a little bit after, 10, 15 minutes after breakfast, lunch and dinner, that will massively help to control your after meal spikes in blood glucose and help spread it out across the day as well.
Could that mean just a 10-minute walk, say, after you've had your lunch, for example?
Yeah, it's amazing what a 10-minute walk can do.
Okay. And so if you do nothing else, just 10 minutes after lunch will help.
After all meals.
After all meals. Thanks.
Yeah, and it's such a good tip for, people who are time constrained. They don't have much time to spare, or, I don't have 30 minutes in a day to spare and do this. Breaking it up to 10 or 15 minutes, like in the morning, parking your car a bit further, when you go to work, taking that break after lunch, get out of the office, go for a little walk. In the evening, you're walking back to your car or taking, going for a walk after dinner. That does it. Anything is much better than nothing.
Perfect. Thanks, Beenu.
Shall I just finish off my other little couple of points there?
Absolutely, Natalie, yeah.
So obviously, just to finish up from what I was speaking about with dietary suggestions and things that you can focus on, something like reducing sugar or processed foods in particular from your diet can really help. It's not to say you don't have, you should never eat them, but definitely reducing that quantity of processed foods, whether that's takeaway, chocolate biscuits, chips, ice cream, those processed foods that is an abundance to us in the supermarket, unfortunately, is really important to reduce the intake and really get back to basics. Things like that bottom picture there around plant-based eating. There's a lot of information coming out around how important including more plants and vegetables, legumes, beans are important for our health. Lentils, those sorts of foods, and your healthy grains, and including them in a healthy balanced diet will help to improve your diabetes control. That's all from me.
Great, thanks, Natalie.
Thank
Well,
you.
while we've got you, there is a question here from Kimberly, who wants to know what your thoughts are on fasting if you're trying to manage type 2 diabetes.
Yes
Yeah, or
so
no?
there are different ways to fast. There's the 5 and 2 style of dieting, which can influence your time that you fast just for 2 days a week, or there are other styles where you reduce your fasting window across the day. So you might fast for 8 hours and then eat for no, other way around. Eat for 8 hours, fast for 16 hours, and there's evidence coming out around those areas. It's still being researched about the benefits of those types of diets. In the long run, it really is going to reduce your intake of calories over the day. And I think that's the most important thing, because people will tend to pick a window of time, and then it can help people who might overconsume in the evening to limit that, put a bit of a time on there to prevent you from eating later into the evening. But definitely there is a lot of evidence coming out around fasting. It is about finding which style of fasting will work for you and ensuring that it's something that you might be able to put into your diet plan over the week and do it well. Might be worthwhile having a chat with a dietitian to get that timing right, that's going to work in with your lifestyle and set you up on a good path.
Great, thanks, Natalie. And there was a question, I can't see it now, but somebody had asked, what's the best way for them for people to find help to help build their team around them to help keep them on track? Is it a case of going to your GP and then getting referred, or is there a website that people can go to get this kind of information? That's to any of our panelists who are able to answer that.
Beenu, do you want to answer that? You're on mute though.
Back on track. I'll just share my screen again. I've got a list of resources that might help.
Just bear in mind, we only have a minute left, so perhaps you might not have time for your screen, but I can definitely share that with people afterwards. Yeah.
So there's Get Healthy service. It's one of the NSW health, endorsed websites. They're really helpful.
Get Healthy.
Yeah, Get Healthy.
All right, I'll try and find it and put it in the chat while you're talking.
Yeah, I can post it there afterwards if that's any good. So it's telephone coaching involved. So if anyone wants to lose weight, or if they have any chronic conditions or diagnosed with pre-diabetes, any of that, they can help. And for people with diabetes, there's another program by Diabetes NSW called Beat It program. And that's good too, because there's a lot of information, and you will have, supervision from an exercise physiologist, as well as, dietitian who can guide you through the process. And if you have any, be near a gym, that's helpful as well. And through the GP, if you are diagnosed with diabetes, through your GP, you get access to the care plan through which you can access allied health visits as well. And if you haven't heard of National Diabetes Service Scheme, on their website, there's a really good program on type 2 diabetes and me. There are, short videos you can play and understand what it's all about, what is helpful. And, if you are at risk of diabetes, there is another one called, you can check your risk. And then from there, you can think about, okay, what to do next? Do I meet with my GP and organize for the testing? So there's an OSD risk assessment tool as well, which is really helpful to find out where you are in this, risk of diabetes.
Where was that risk assessment tool, Beenu?
I can type it in. OSD.
Yeah. Well, I'll let you type that in. And I just wonder, I know we're so close to going over time, but I just wonder, it just occurred to me, and this might not be news to other people, but can somebody just briefly go through what the symptoms are of, if you are pre-diabetic or diabetic, what should people be looking for that will prompt them to go and get help?
Yeah, unfortunately, that's the trouble. There's no specific symptoms for people with diabetes. When your sugar levels are that high, say, about 15, that's officially high blood glucose level. You do get you do feel a bit thirsty. You feel really tired. You would be peeing more, especially at night, waking up more than 2 times to go to the toilet. Or, you may have some skin irritations. You might get mood swings. Your eyes might be a bit blurred than normal. See, all these symptoms are so common that anyone can, just think it's something else. So the only way to find out if you're at risk of diabetes or if you have diabetes is to get a proper blood test.
Okay, so if you think you may be at risk, just go and see your GP and ask for a test.
Yeah.
Oh gosh, we always run out of time with these webinars, so apologies for any questions that we haven't quite got to. I just want to wrap up by asking our panelists to give just one little gold nugget of information for our audience to take away with them. Beenu, perhaps I could start with you. What's the one thing you want people to take away from today's webinar?
Get tested.
Get tested. Go to GP, get tested. Natalie?
Mine would be, can I say 2?
Sure.
Portion control. Really think about your portions and those low GI carbohydrates, and aim for balanced, sustainable lifestyle change, not a quick fix. It's something that you've got to really think about, put into practice.
And so seek help.
Seek help.
A dietitian to help guide you to make that sustainable change.
Definitely.
Thanks, Natalie. And Monique?
Easy. Move about 30 to 60 minutes after you eat. Just move, hang the washing out, do something, just don't sit down.
Perfect. Oh, well, look, thank you so much to all of our panelists. I've really enjoyed today's webinar, and I feel like I have learnt a huge amount. I hope our audience feels the same and has too. Thank you for your engagement, for your comments in the chat, and for your questions. We really appreciate that. To our panelists again, thanks for sharing your research and your experiences and your work in this area. I know I'm sure I can speak for all of our audience that the work you're doing is making a huge difference, and we're really grateful for your dedication and to improving outcomes of patients in our area. So thank you so much. I will share as much information as we've covered today as I remember, and I'll check with our panelists as well in that follow-up email. So keep an eye out for that in the next few days. Including more information. I know Monique shared it in the chat, but information on or where to get more information about those clinical trials that she's conducting this year and next year. If you don't already, follow our Facebook page. It's at IHMRI, so at IHMRI, and check out our website, imri.org.au. We have a lot of information about the different research that we cover and events that we've got taking place. We hope to have a lot more face-to-face next year, including an open day where we will invite you into our building. You can see the building just behind me there. We'd love to get you in and meet our researchers and take part in some hands-on experiments and activities. So keep an eye out for that. We do have a survey, just for 3 or 4 questions, very, very brief survey at the end of this webinar. I would love you to fill that in if you do have a spare 2 minutes. That will give us an idea of future content for content for future webinars, to make sure we're actually delivering content that you, our community audience, are interested in. So if you do have a chance, please do fill that in. So that's it for today. Apologies for going a little bit over. Huge thanks again to our panelists and our audience, and we hope to see you at the next webinar. Bye everyone.
Thank you.